I was first diagnosed with epilepsy when I was 13 years old, and it was really hard because I was a straight A student, and played a lot of sports. I was very active, and had a lot of friends, did a lot of things, and a lot of that changed when I was diagnosed. I couldn't play sports as much. My grades, they slowly began to drop. Probably because of the amount of medicine I was put on, and my seizures increased.
Kate's first seizure was pretty intense, and I met them in the emergency room. Kate had no sensation on her left side when she came to in the emergency room, and at first I thought she might have had a stroke because we don't have any family history of seizures, and there'd been no indication that there was a problem.
They used to be really so bad that when the firemen would come, when we would call 911, I would wiggle off the board that they put you on, and I would call me Houdini, because they would strap me down, and then they'd look back and I'd already be off the board, and they'd be what are we gonna do now?
I think in total she's tried at least 12 different medications, and they all have side effects. And at first you'd think maybe it's going to work, and it would only be for a little while, and then the seizures would come back and get worse, or change their character. It wasn't too long, maybe about a little over a year after the first seizure, that her doctor on the South Shore asked us to come to Children's to see the epilepsy team here, and worked with Dr. Riviello. Was wonderful, and through him we met Dr. Rotenberg, and he tried all kinds of things to help Kate.
TMS stands for Transcranial Magnetic Stimulation, and it's a method to electrically stimulate the brain, non-invasively, that is without any surgery, with a very strong magnet that's positioned usually by hand over the patient's scalp. That magnet produces electricity everywhere around it, including in the brain if it's positioned near the brain. And it turns out that in the brain there is a property such that if we stimulate the brain not very often, let's say once per second, that stimulation reduces brain excitability. And in epilepsy, where the problem is excess brain excitability, if we're fortunate to have a patient whose seizure focus is close to the skull surface, to the brain surface, and we stimulate with TMS that seizure focus to reduce its excitability, we sometimes see a reduction of seizure.
Kate started the TMS treatments in March, and we started very slowly. I think she had one treatment, and then a couple of days later she had a day where we saw no seizures, and we were like, okay, sure. And then she came back, and Dr. Rotenberg gave her a couple more treatments, and she had a couple of seizure-free days in a row. And it had been so long since we'd had any seizure-free days, which is huge, that we were almost afraid to be a little hopeful, truthfully.
I went from having seizures every single day to having seizure-free days almost immediately. So it's just perfect. And now I've gone after 3 years of doing this, now I've gone 7 months seizure-free. Awesome.
She has some girlfriends who know what to do if she had a seizure, and they take her little VNS magnet with them, but they go to clubs in town, and I'm getting to hear those stories. I never thought that I'd get to live this part of young adult life with Kate as I did with my other children, coming home with funny stories about a Halloween party at the Black Rose, and she's taking college courses and getting A's. She's very focused, very driven. She will not quit, and that is heavenly to see again.
I'm cautiously optimistic. I think that's the only scientifically justified position to be. I don't think that we could say that we've found a cure. I think we're on the right track.
It's changed it completely. Like, I have so much more freedom. I can stay home alone. I can I can just do so much more things. I've gone back to school, to college. I'm looking forward to so many new things that I wouldn't have been able to look forward to, if I didn't do TMS. It's just such a life changer. It's awesome.